Pediatric medicine is the future of children. The pediatric program at Lurie Children's has a strong tradition of being an outstanding educational program. Our move to the medical school campus here has only given us more opportunities to enhance our educational programs.
Everyone is passionate and excited and come to work every day excited to learn and to teach and to take care of some pretty awesome children.
We take care of a lot of really sick kids, and it's great when you can see them get better and go home.
We are looking for residents who are excited about learning and about teaching, passionate about pediatrics and about advocating for children, people who are team players, and really people who like to kick back and have a little fun every once in a while.
Despite all the kind of academic underpinnings and the size of the program and everything else, it feels like a very small community. So you get to know everybody very well. It feels like a family when you're here.
One of the things I looked for when I visited different residency programs was to see how well the residents got along with each other. And one of the things that I liked the most about Lurie Children's was how the residents genuinely seemed to be friends with each other. And they also seemed smart, seemed to really push each other and work along well together.
I love the people that I work with, and that really kind of goes from the top down.
On rounds every day, you're talking with the attendings, you're talking with the nurses, with the different ancillary staff, and it really is a very community-based environment.
It surprises me on a daily basis how approachable the attendings are.
The residents get to know the faculty on a first-name basis. We work in very small groups on the ward services, so there may be teams of 2 or 3 residents per faculty member.
Because we've had such a strong residency program here and such an outstanding educational program, we've been able to attract faculty that are enamored with and love education.
We have great faculty involvement in our conferences, which I think really keeps the level of conversation rigorous.
I've been amazed on a daily basis the conferences that we have, the discussions that are brought up, and the learning that we get out of it.
When I interviewed here, we got to attend one of the morning reports, and I got a sense that the residents here were really engaged in taking care of their patients and really understanding the science and the medicine behind what they were doing.
There's a lot of time dedicated to education because residents love that time.
The people really consider it their responsibility to be thoughtful and inquisitive and to share the things that they learn with their colleagues.
The residents are amazing, enthusiastic, supportive of each other, excited about learning, and excited about taking care of patients.
I think the program has a lot to offer. So first of all, it's a really big academic institution in an unbelievable city to live in.
So you might hear us described as a work hard, play hard sort of place. When you're here, you're doing the work that needs to be done to take care of sick kids. But when you're not, you're out there enjoying all that Chicago has to offer.
A lot of people come here, I think, because we're in a busy metropolitan area. We take care of an amazing array of disease processes.
We get to see everything, and so that's all the bread and butter pediatrics that we want to see as a pediatrician, but also the rarest of the rare.
Lurie Children's and the residency program here prepares you to do whatever you want to do.
We try to tailor their learning experience to whatever avenue they would like to travel within pediatrics.
We have a clinical area where we work with residents on fancy mannequins to practice patient care. We have also several associated classrooms where we talk about how the care went during the cases.
All residents at Lurie Children's do a senior project, which can be on a variety of topics, but in general is a research-based project. My project in particular ended with a poster presentation at a national conference. It was a great experience to see pediatrics on the national scene.
We also have our continuity clinic where you take care of your own cohort of patients, and I've seen kids who I took care of in the NICU come to my clinic, and now they're 3 years old and they're going off to preschool, and so that's pretty awesome to be able to see them kind of grow up in front of your eyes.
There are lots of opportunities for international health at Lurie Children's. I spent a month in Tanzania during my 3rd year, seeing a lot of really interesting pathology unique to developing countries.
I think one of the best parts about being in the city of Chicago are some of the opportunities for advocacy.
So we have a community medicine and advocacy rotation that all second years are part of, and that is really just to get your feet wet.
We are really situated very close to the American Academy of Pediatrics, and many residents have chosen to go on and do rotations and work with them as well.
So I think during intern year, this program just does an excellent job of finding the perfect balance between providing so much support to the residents and yet finding the right time and the right ways to step back so that the residents really get to develop autonomy and confidence in their clinical skills.
One of the strengths that I see at Lurie Children's is the diversity of interest, both among residents and faculty. I love that there are people that are involved in clinical medicine, bench research, translational research, and no matter what you want to go into, you can always find somebody who will support you and mentor you through it.
It's really well balanced with how many residents go into primary care versus how many go on to fellowships. And I think it's something that we're very proud of.
They get a lot of training in leadership and communication, and it's really fun to watch them grow from when they're interns through to when they're senior residents and are directing the interns in patient care here.
I came in feeling uncomfortable and nervous, and over the past few months I can really see how I've gotten more confident and more comfortable in my role, and that's been pretty cool.
There is no question that the most special part of our program are our residents.
Our residents at Lurie Children's are bright, energetic, committed, and obviously love children.
We obviously have a large residency program and we get lots of personalities from all over the country.
People have had different clinical training, different didactic training, and so coming together, there's a lot to learn from each other.
Very few actually have known each other beforehand, but by the time they leave here, the bonds that they form are bonds that will stay with them forever.